Researchers believe the virus, which has killed at least 139 people, began making it much harder to track those. The strain has a fatality rate of approximately.
There are several factors potential for further spread and further deaths. First, beyond the confirmed cases, there are almost 600 suspected cases and 139 suspected deaths. We expect those numbers to keep increasing, given the amount of time the virus was circulating before the outbreak was detected.
No vaccine or specific treatments exist for the strain. Even the Democratic Republic of Congo, 2 months before a vaccine is developed, with 3 to 9 months being a more likely timetable. One confirmed case is an American doctor who is working in Congo. He's been transferred to Berlin for treatment. The U.S., which withdrew from the WHO under President Donald Trump, has committed $13 million to Ebola response. Some experts fear the response has been hampered by U.S. cutbacks to global public health. But the Director General of the WHO says the cutbacks have contributed to the development. CGTN, Washington.
China has completed a full system rehearsal of the Shenzhou 23 crewed space mission ahead of its launch to the Tiangong space station. The rehearsal involved the entire launch process, including flight preparation, ignition and liftoff, and spaceship rocket separation. Last week, the Shenzhou 23 spaceship and its carrier rocket were transported to the launch pad at the Jiuquan Satellite Launch Center in northwest China. Officials say the launch will take place at an appropriate time in the coming days. And that's it for this edition of The World Today. I'll be back shortly for Continent and Africa Live. I'll see you shortly. Thanks. The World Health Organization increases emergency shipments to the DRC amid rising Ebola cases. Boko Haram militants killed 33 fishermen and loggers in northeast Nigeria. Sierra Leone receives migrants deported from the U.S. This is Africa Live. Hello and thank you for joining us. I am Peninah Karibe. Also coming up this hour. In business, Zimbabwe begins formal negotiations to join the BRICS-backed New Development Bank. And in sports, the Ebola outbreak in the DRC forces the Leopards to alter their pre-tournament plans for the World Cup. The World Health Organization is ramping up emergency shipment equipment and medical supplies are not to contain the 17th outbreak in the Central African country. CGTN's Sharon Baranga reports.
At Kenya's Jomo Kenyatta International Airport, emergency aid is being rushed onto a UN aircraft bound for eastern DRC. The WHO says it has now shipped more than 22 tons of medical cargo to help combat the growing Ebola outbreak centered in Bunia in Ituri province. They include tents, protective gear, disposable face masks, burials, and prevent
a Dash 8 aircraft take off with 6 tons of cargo from JKIA in Nairobi, Kenya, to direct to Bunia, which is the closest international airport at the epicenter of the current outbreak.
WHO officials says the outbreak had been detected for weeks before testing was completed. So far, 51 cases have been confirmed in the DRC's northern provinces of Ituri and North Kivu, and 2 more in Uganda. Health agencies also report nearly 600 suspected cases and more than 100 suspected groups warn that stopping the outbreak alone.
You have to combine that with engaging communities and building trust. We should anticipate there would be several setbacks to being able to curb this epidemic, and so you need to prioritize the protective equipment, the medical supplies, the training for healthcare personnel, all of that sort of medical side of things with community engagement, with awareness messaging, with prevention work.
Humanitarian organizations say fear, stigma, and mistrust could discourage people from seeking treatment or cooperating with contact tracers, increasing the risk of further spread. For now, emergency flights and road convoys continue moving supplies into affected regions as international agencies work around the clock to contain the outbreak. CGTN.
Rwanda has closed its border with the DRC after a case was confirmed in nearby Goma under M23 rebel control since February 2025. This is already affecting the local economy as cross-border trade is key to local livelihoods. CGTN's Jin Keo with more.
It's market day here in Mikeno district in eastern DRC's Goma. But there's very little traffic today after Rwandan authorities ordered the closure of the Gisenyi border point, and everyone is feeling the pinch.
We source our chicken from Rwanda, carry out random tests at the border to Rwandans to continue crossing the border to supply us with chicken, and for us to be able to go to Rwanda for other purchases too. That is what is good for us.
Trade is not going on well. Rwandans and the Congolese used to work together in trade, but that's no longer the case. But because the border is closed, weaker businesses have come to a standstill.
Frank Paluku uses his modified handcart to he could cross the border numerous times to make one trip to the border.
The Ebola virus has really disrupted my work. I cannot cross the border. I'm struggling to feed my children. As a person living with disability, my life is very difficult because I can't do any other work. Transporting goods was my way of survival.
Normally about 40,000 people shuttle between the two countries using the Gisenyi border point daily. But now, the flow has come to a standstill, putting locals on both sides of the border. Jin Keo, CGTN.
Let's bring in Dr. Anne Ansia, the country representative currently stands here, the World Health may have been circulating for months. How and why can Ebola circulate for months without detection?
It might not be for months, but for weeks, certainly. Yes, it's because really of the particularity of the province where we are. You know, it's a province that is facing a lot of insecurity and movement of population. The epicenter of the outbreak, which is in a remote area, 76 kilometers northwest of the city, is a place where there is a lot of high insecurity, a lot of clandestine. You know, people move silently, and therefore, you know, there is not a lot of clear information that is coming out of there. There has been also a lot of cultural misbelief there. So the story that we hear all the time is that there was actually a person who died in Rwampara, which is a neighborhood close to the city of Bunia. The body was brought back into Mongwalu, the epicenter of the outbreak, and in the night the coffin. And so they changed the coffin, so this came. But then there was a whole mess that came out of this story, with people saying, you know, they were hearing knocking at the door, and then they were opening the door, and they were seeing the coffin and people were dying. So a lot of mess. But the main problem is actually that there was an investigation team in the province who went to Mongwalu and sent back samples, and the samples were sent in the laboratory in Bunia, and the laboratory in Bunia can do diagnostic of Ebola Zaire. The site is actually the subtype Budibunjo. People were thinking, no, it's Ebola, it's Salmonella. So it's really a hazard there, because in the area, and we start working with the health authorities from the province, and then we looked again and we looked at the case definition, and we could see that several cases, you could see the bleeding at the end. You know, you wait, you've got symptoms of fever, diarrhea, vomiting, fatigue, myasthenia, myalgia, and then some cases were really those bleeding. No, it's probably Ebola. Let's send us into the National Institute for Biomedical Research. Indeed Ebola, but not Ebola Zaire, but Ebola Budibunjo. And then the Minister of Health systematically declared the outbreak, and we can really start from day one, then really establishing the operation. First, with the health authorities on the ground, we started to organize all the different health authorities by the pillar of the response: case management, surveillance, contact tracing, risk communication, strengthening laboratory diagnostic, organizing all the logistics, and then on the 400 health professionals from the and we started to bring and to start health professionals that are on the ground, and we already brought 28 tons of supplies on the ground.
Well, having listened to that explanation you've given us, I'm just wondering, were there early warning signs that were missed out by the health systems? And what does that really say about the state of preparedness, especially given that Ebola is endemic in the DRC?
Yeah. There is a certain level of preparedness, but it's not enough. It is not enough. And we have been training but they got really to beef up that laboratory. The laboratory has just been revamped by actually the World Bank here, but they are missing the reagent. So we are bringing now the reagent. And the problem is, you train people, but if you're not there all the time to refresh people are very, very quickly forgetting. And you know, it's a province, you have to understand, it's a province where there is lots and lots of health issues. You know, just the vaccine coverage in the province, 37% of the population, which is extremely low. So there is a high maternal mortality rate, you have tuberculosis, you've got HIV/AIDS, the human resources are overwhelmed, they're not well paid, and therefore there is a kind of fatigue with a humanitarian crisis and a population that is vulnerable for years and years and years. And sometimes in this kind of situation, there is so many alerts, so many requests, so many demands from the population for improved health services that the national authorities and the health professionals, they're doing their best and very big. But we need to work all together to improve this, and really the international communities, us and other health sector partners, we really need to work harder and harder and harder to address those kind of situations.
Well, it does sound like a difficult situation, Dr. Ansia. Thank you for all that you're doing there, and thank you for speaking to us today. Dr. Ansia speaking to us there from Bunia in Eastern DRC. Now, as we heard, the World Health Organization expects the disease to spread within a global spread remaining low. Authorities across the region to some cities such as Goma, is proving troublesome, and that may mean hospitals will not get the critical supplies that they need. CGTN's Caroline B reports.
At the main checkpoint into rebel-held Goma, drivers and passengers are stopped for mandatory hand washing, temperature screening and face masks checks before entering the city. Authorities imposed the tighter controls after confirming an Ebola case in the city of more than 2 million people that borders. Residents acknowledge the process.
Understand that the disease exists. It has neither vaccine nor medicine. The best prevention is to wash your hands with water and soap, and that everyone accepts that the epidemic is real.
I'm washing my hands on arriving here because I'm coming back from a funeral. I do not bring germs into our city.
Health workers are also screening residents outside government buildings and in the streets of Goma, as officials race to prevent wider transmission amongst a population still unprotected.
It declared on May 16th that a person in Goma is affected. That is why we have established barrier measures so that people can observe them, so that it cannot spread in the city of Goma.
The stakes are dangerously high. The World Health Organization has reported 600 suspected cases and 139 suspected deaths across the DRC and Uganda, caused by Bundibugyo, a rare strain with no approved vaccine. The fear has trickled. At Panzi Hospital, medical teams are on high alert, bracing for an influx of patients, but without the resources to deal with them. Ambulances remain on standby while doctors hold emergency meetings.
A sample from Bukavu has to cross Lake Kivu by boat to Goma, take a taxi to Beni Butembo, then a flight to Kinshasa. This delay is not good for managing an epidemic. It is a major logistical constraint, and the authorities must think about it.
Bukavu faces a logistical nightmare. It is also under rebel location, which is severely disrupting local testing, and local authorities say they are doing what they can with population tracking.
At all entry points to the city of Bukavu, epidemiological control and surveillance measures have been put in place, as well as tracing of the population, and will continue for as long as necessary.
But in a densely populated city, residents fear the outbreak could overwhelm communities, as it remains a challenge.
It has become a problem if the disease arises because Bukavu is very densely populated.
Monitoring and contact tracing Bukavu, the World Health Organization an emergency of international concern, warning the virus may have circulated undetected for weeks before being identified. Caroline B., CGTN.
Now to northern Nigeria, where the government continues to face a massive security crisis. In Borno State, Boko Haram jihadists are reported to have killed as many as 27 fishermen and 6 loggers in separate attacks. Local sources told AFP that the fishermen were intercepted by the Boko Haram fighters aboard motorcycles in town. They were returning from work. Firewood in the bush in Dikwa district. 2 weeks ago, Boko Haram fighters shot dead 18 loggers outside Abaram village in Borno State's Bama district. The jihadist group has been carrying out an insurgency since 2009, one which has killed tens of thousands of people and displaced millions. Most of the displaced live in makeshift camps, relying on food handouts from aid agencies. Boko Haram and the rival Islamic State West Africa province often attack them of spying and passing on information. Sierra Leone has been expelled from the U.S., becoming the latest immigrants from the U.S. The country's foreign minister initially saying 25 migrants would arrive. The deportees are natives of neighboring Nigeria, Ghana and Guinea. Some hold Sierra Leonean residence permits. They will have the right to stay in the country for 90 days before they must return to their countries of origin. Authorities in Freetown have agreed to accept up to 300 deportees a year, but only from members of the economic community of West African states. Foreign Minister Musa Kaba said the U.S. was providing $1.5 million to cover humanitarian costs. Other African countries to have received the Democratic Republic of Ghana, Rwanda and South Sudan. This month, Egypt inaugurated the world's longest monorail network. The 96-kilometer project connects the further stretches of Cairo to the new administrative capital. At full capacity, it will be able to move 500,000 commuters daily. Adel Mahroui brings us that story from Cairo.
The inauguration of Egypt's first monorail project covered a 3-day pass. Many took their children
to see it. My daughter is to buy for sure. It's beautiful, and I hope Egypt will excel even more. Seeing the new capital by this train was great. I see the progress. It is more crowded than before.
With its unique entrance through the gates of the new capital and view of the central business district, the project has a potential of becoming a major touristic attraction, where commuters get to enjoy the Chinese-built iconic tower, the tallest building in Africa.
I've been following its construction over the years. I saw Egypt during President Hosni Mubarak and during Morsi, development and stability. I also see people from Africa. The East mother of the world is something I can relate to.
It took 5 years to build a monorail with an estimated total budget of $4.5 billion.
We are proud that we work on national projects that have a lasting impact. Each one of us is proud when we talk with our families or friends. And in the future, I will tell my kids that I participated in this project.
Currently, the trains only work, but at full capacity, each train will have 800,000 commuters daily.
The monorail line is operable. That covers the entire new administrative capital and the new Cairo areas. The final part that will connect this eastern extension to the capital, Cairo, will come into operation within the next 2 months. The second part of the project west of the Egyptian capital will come into operation next year and will be connected to the Eastern Line through the Cairo Underground Metro Network. CGTN, Cairo.
You're watching news. Formal negotiations to join the battle. And international investors eye developments in South Africa after the Constitutional Court cleared the way for impeachment proceedings against President Cyril Ramaphosa.
You don't find the stories of North Africa by sitting on the sidelines. You've got to get out, go there, and you'll find them. In the bazaars of Casablanca, among the crowds in Cairo,
who come to visit Cairo, the ancient,
along the waters of the Nile, on the sands of the Sahara. No one else will take you where we can in North Africa. No one else will show you what it's all about. CGTN, see the difference.
This year's Biashara Africa Conference has concluded in the Togolese capital. Organizers said the private sector trade platform trade beyond ambition, and the head of the African Continental Free Trade cited it as a major success.
Ahead of the conclusion of the Biashara Africa Conference 2026, the Secretariat's Secretary General signed 3 memoranda of understanding that are aimed at deepening trade integration, strengthening financial inclusion, and enhancing partnerships across the continent.
We have to focus on investing in industrial development so that we build our invest in infrastructure. The disbursements that the AFCFTA Adjustment Fund has already made are exactly for this purpose. We are also engaging our development partners, the DFIs, Afrexim Bank, AFDB, Africa 50, to ensure target specific sectors in country to enhance competitiveness.
And they specifically address issues such as trade integration, access to funds, and particularly for small, medium enterprises that as well as ensure across the African continent amongst businesses and investors.
220 billion in intra-African trade, as a value. What does that mean? It means that things are happening, not fast enough, but we must look at those numbers as a signal of hope, understanding which value chains they are, and start to invest there for expansion.
But there are teething issues that small, medium enterprises, young innovators need addressed.
Selling in Togo here, we don't have many customers. In other countries can make me like customers, but the price that's different than the price that I will sell to sell it in another country.
At the same time, China's zero tariff policy for African exporters has been commended, with regional economic blocs challenge to boost local capacity for value addition and trade in order to boost Africa's exports to China.
SMEs need capital. They need capital without these requirements like Corato ETC. They need logistics.
I spoke to some of the business leaders, innovators, entrepreneurs, get a feel of what they make of this year's.
What's instructive
an example of leadership, an example of what can happen if the political will is there to make the change that Africa deserves for us to be able to implement a borderless trade in Africa.
And I think the biggest highlight for me has been being part of the ministerial roundtable discussion, where we had a number of ministers essentially listening to the private sector, including ABAN, some of the challenges that we face.
Regional trade and have called for stronger collaboration in harmonizing competition laws in order to protect businesses, consumers and regional markets as momentum builds towards the implementation of a free trade area for Africa. Zawadim Dibo, CGTN, Lome, Togo.
Zimbabwe has begun formal negotiations to join the new development bank established by the BRICS group. Government officials say they are confident members in long-term financing from traditional Western lenders. CGTN's Farai Mokutuya reports from Harare.
The government says this move is part of a broader shift towards deeper cooperation with emerging economies as the country looks for alternative sources of development funding outside of traditional institutions such as the IMF and the World Bank. Finance Minister Mutuli Ncube confirmed that Zimbabwe has a Shanghai-based bank to begin the accession process following President Emerson Mnangagwa's initial application. Authorities say membership could help mobilize long-term capital for major infrastructure projects, energy security programs, and climate resilience initiatives under Zimbabwe's National Development Strategy 2. The negotiations mark a significant diplomatic and economic milestone for Zimbabwe, which has been locked out of international funding. Details on the accession will be confirmed. Zimbabwe.
Eyeing developments in South Africa, impeachment proceedings against Cyril Ramaphosa. In 2022, a former spy boss laid charges against the country's president for trying to cover up the theft of $580,000 from his Palapala game farm. Ramaphosa has denied any wrongdoing and was never charged, but an independent panel found evidence of misconduct. Despite the report, Parliament had voted against further investigations, a move that has now been overturned. Sumitra Naidu tells us more.
The country significant judgments since the president to step down, but President Ramaphosa said he would not resign.
My fellow South Africans, while there have been calls in some circles that I should resign, nothing in the Constitutional Court judgment compels me to resign my office.
Markets were muted following the speech, suggesting that it was the right move. The rand remained on the back foot, but this was due to geopolitics.
If Ramaphosa were to resign and be replaced by someone else, I think investor confidence would take a knock. That investors believe that the glue that keeps
the political noise has intensified and is again testing South Africa's government of national unity.
The concept of a GNU coalition in South Africa is now well established. It only took 24 months or so, but it is well established. Now, what is unfashionable at this point in time is to be outside of the coalition. If you are outside of the coalition, you are in the cold. Anybody who pushes a view that the coalition will fall apart, that is a wrong.
It has already positioned itself for continuity of the coalition in areas such as rail, energy and state restructuring.
The issue that has not been solved, that needs to be solved, is the issue of how to get GDP growth rate from 1% to 5.4% or 6%. I am not aware of anybody who's got a solution to that problem. And it is a problem. That's the main problem in the economy that needs to be solved.
However, Jameen argues that any forced exit by Ramaphosa will have consequences to.
There are suspicions that some of the being lined up by the ANC are implicated in corrupt activities or don't have the same gravitas as Ramaphosa has. So I think that there would be a loss of confidence and a belief that the government of national unity under some other leadership could well break up.
The market is not currently pricing in an imminent impeachment, but a leadership change is likely to trigger investor reactions. Depending on the success of the rand, it could push up in borrowing costs. Sumitra Nadu, CGTN, Johannesburg.
This is Africa Live. Coming up in sports. The Ebola outbreak in the DRC forces the Leopards to alter their pre-tournament plans for the World Cup.
The greatest journeys, the greatest sights, the greatest adventures.
Here in Kanata, this weir allows the locals to walk on water.
We're far more than your passport.